Welcome to Max Herb Talk. We at the 45th Annual Cancer Control Society Convention. Wow, it's in Glendale. Sitting here next to me is Dr. Joseph Sarkissian, and he's going to talk to us about some of the dentistry that he practiced. How you doing today, Dr. Sarkissian?
I'm great. How are you? Thanks for the interview.
I am doing great. Why don't you give our audience first a little background on yourself, and then we'll get into some of the things that you brought to the convention.
I'm Dr. Joseph Sarkissian, practice in Glendale. I studied in Germany. About 25 years ago, I graduated. A year after I graduated, I heard about Hal Huggins, and of course, a whole new world opened up in front of me. And so therefore, today, I'm considered to be a biological dentist.
Okay, now I know it's a lot of terms out there. They have complementary dentistry. He said he's biological. I like to look for holistic. So is there a big difference in all these different terms that's thrown around and used out there, Dr. Sarkissian?
Well, let me tell you something. I think every dentist should be a biological dentist. But in general, biological dentistry, holistic dentistry, or complementary dentistry, it's just an umbrella term. A lot of dentists in this field just use different modalities, but I think one thing unifies us the most is that we shouldn't use any amalgam, and we should remove amalgam, taking extreme precautions so that we are not subjected to all the mercury that emanates from these toxic fillings.
Wow. Now, toxins, that's something that here at Max Herb Talk, we like to inform you all about different ways you can lead a healthier lifestyle. Some of you may know that the silver amalgam that he's talking about is harmful to the
Almost
body.
everything foreign may have some kind of harm to the body, but we have to choose carefully and try to minimize everything that we're doing to the body that may be harmful or damaging. So basically, the first principle in medicine is to do no harm, primum non nocere, which means anything we use in the body, we have to look at the big picture. We cannot just look at the teeth. We can't just look at the gums. We have to look at the whole organism. And whatever we implant in the teeth or in the gums or in the bone should be biocompatible to a certain extent.
Recently, I was talking with a friend. He's from Africa, and he was telling me how he chews on this stick. It's like a herbal branch or stick or something. And he said he never have used a toothbrush and toothpaste. And he just chews on this stick, and he said his teeth is in good order. Do you know anything or can share anything with our audience of how the African culture uses this tree branch to chew on, and it helps the teeth? And here we have to go to a dentist to get a cavity fix or something like that.
Well, that was very well known that in tribal societies or in very old indigenous societies where there was no Western influence, the diet was very original and not influenced by all the processed foods of the industrial nations. That the teeth, and not only the teeth, but the jaws were healthy. The immune system of these inhabitants was sound, and they didn't have any decay or very little decay, a little bit of gum disease maybe, but they kept all their teeth all the way to the end of their life, and as soon as you had a little bit of Western diet introduced into that habitat, then their not only their teeth started rotting, but also their jaws didn't develop correctly. And this is the work of Dr. Weston Price, and I take my hat off for him. And he went and studied these tribes in detail, and I can see all the connections that he was trying to make. That was about more than 100 years ago.
Wow.
But, I mean, you can see why we need dentistry today, because we live in an industrialized society.
Yeah, true. But I know just recently I bought a book on dental natural health. And in this book, I haven't read it yet, but it talks about, running through the table of contents a little bit, different herbs and washes that you can make to wash your mouth or rinse your mouth, which will also help to prevent things, I guess, like decay, like plaque buildup, and
There
things
are
like
a
that.
myriad of materials and herbs that you can use. Of course, foremost is prevention. But as you mentioned, those sticks that they used in Africa, nowadays I recommend just licorice roots that you can actually start chewing on, and as the ends start fraying, the fibers get exposed, and then you can rub those on your teeth and your gums. It has a perfect cortisone stimulating effect that really battles inflammation and also kills plaque bacteria.
Wow.
But you can also floss with xylitol, which is a type of sugar which is also a material that will starve the plaque bacteria to death. So I recommend that for particularly for children and to floss with. And there are lots of herbs you can use in the mouth, like sage, myrrh, tea tree oil, carefully, of course, because you don't want to use too much,
Of the tea
aggressive.
tree?
Dentistry is the only field in medicine that actually goes and cuts away infected tissue, which is not right, biologically speaking.
Okay.
Because when you have gum pockets populated with millions of bacteria, and some of those bacteria are really aggressive gram-negative bacteria, and spirochetes, which are those little wiggly worms that you see in the microscope. If you go in there and aggressively scrape away at the gums and the teeth, now millions of those bacteria are going to go, guess where? Into the bloodstream.
Into the,
And then
to the body.
They're going to go and lodge into your heart lining, into your kidneys, into your joints, and that's when you create a havoc situation in your body. So biologically approaching gum disease has to do with a holistic method, which means why is gum disease there in the first place? The immune system has to be boosted. You have to gently start debriding the teeth and teaching the patient how to take care of the teeth and how to brush properly, because there's no point in getting a deep cleaning and then 3 months later you follow your same oral hygiene habits and then you have to go have a deep cleaning again all over. So,
Wow.
I mean, the holistic approach in this particular disease is, I think, the most important. And people don't even realize what an effect it has on your general health.
So you're saying that all of these toxins, when they do the deep cleaning, will go into my blood and then be transferred throughout my body, possibly causing other ill effects for me. Is that right?
That's absolutely correct. And that's also accepted by the mainstream.
By the ADA,
yeah.
American Dental Association. Okay. But so how would you go about, I guess, that in your office, if you don't do deep cleaning, how would you go about if a person had these bacteria that was so bad in their gums, Dr. Sarkissian?
Well, first identify the cause. Is it truly a lack of, immune system efficiency, or it's a lack of oral hygiene, or it's just other contributing factors such as overhanging fillings or rough edges around crowns. But how you would approach it is to gently start debriding the teeth, giving the patient instructions. We use a method called Perioprotect, which involves making custom trays and sending them home with the patient, where they use a special peroxide gel to deliver into the pockets of the mouth twice a day. And then as the number of bacteria start being reduced in the pockets, then you start doing, then you go to the next phase where you start lasering the gums and debriding all the dead tissue and killing the rest of the bacteria, and maybe doing a little deep cleaning just to remove the hard deposits. But you have to do the deep cleaning in a slightly later phase than the first phase, which most dentists propose.
Okay. Now, we're not trying to make you all dentists or dental assistants out there, but I just want to ask you about the term you were talking about, debriding or debriving. Can you kind of break that down in layman's terms for us?
Well, debriding is basically removing the layers of hard deposits like tartar or calculus as we call it, along with all the bacteria which are around the gum level and above, not deep into the pocket. Because then that's when you're driving those millions of bacteria into the bloodstream. So the debridement in itself will already create a little bit of a healing response where you can actually start using the PerioProtect method or the deep cleanings later on as the microbial count is reduced.
Okay, let me interject here. Now, isn't the debriding done just when you go get your annual cleaning? Isn't that part of what they do then?
Well, the annual cleaning is just a cleaning that will follow the periodontal treatment. So there should be a plan.
Okay, so the debriding is not done at the annual cleaning. This is something a little bit more comprehensive.
Yes, it's the first phase of gum disease treatment.
Okay.
Whatever you do, you shouldn't do a deep cleaning in infected gums as the first step. But the PerioProtect system is excellent. You can go and check it out online. It's a very well accepted, and a lot of holistic dentists actually use this method. And lasers have certain specific tips that they use that go into the pocket, and they actually zap away all the bacteria and the dead cells that create all that inflammation around the tooth.
Okay, I'm going to have to interject here because I heard someone tell me something about the lasers. Now, aren't you taking a chance on destroying some of the tissue in the gums by using the laser?
The water laser I use has a certain tip that has a triangular tip, and it directs its rays. Its pulses are directed towards the lining of the periodontal pocket, and you have the power set so that you're just ablating or you're radiating the top layers of the infected cells. You're not using a heavy power that you use to cut teeth. So, and you're constantly moving that tip around. So you're actually killing bacteria and just removing the infected cells.
Are you saying that the type of laser that you use is a lot better, and this is not, I guess, like a typical laser that's maybe used for surgery?
Oh yes, absolutely. Surgical lasers have a very aggressive cutting action, and they coagulate blood. But this laser is based on water. It's called a water laser, and it does not create any burning effect. And it has its own pre-programmed setting where it just directs its rays to eliminate the bacteria and just to destroy anything in the vicinity that is infected, a few layers of infected cells.
Okay, so that would make it then more holistic or more biological, or whatever term you want to use then. Is that right, Dr. Sarkissian?
Oh, definitely. Anything that takes into account the whole body and uses the most gentle methods to create a certain result, then is a welcome procedure.
All right. Now, before we go, I just want to touch on a few other things, and then you may want to expound on some, but I just want to let people know out there about experience that I had, because I had a couple of teeth pulled. And then I did a little reading and research on my own, because I kind of follow some of the teachings of Dr. Hal Huggins. And when I got this teeth pulled, I found out that there's a very toxic area in the mouth, what they call the periodontal ligament. Can you talk to us a little bit, our audience, a little bit about how that periodontal ligament has to be free of toxins or removed from the mouth when they're having an extraction?
The periodontal ligament is something that actually holds the tooth in place. In root canal teeth, it is quite a degenerated ligament. So keeping it in there is going to prevent from new blood coming in and forming new bone. So you have to remove it in its entirety. and you even have to remove any soft tissue that remains after any infection has set in after the root canal was placed, because root canal teeth generally have a few pockets of infection around them, and the bone has to be induced to create new bone, and any infected material that's left in there is going to prevent that. And if it heals over and you have certain pockets of those foreign or degenerated materials left in there, then you're going to have little islands of unhealed bone, which are going to be inhabited by opportunistic bacteria, and that will eventually create some sort of cavitation, which will then affect your general health and the well-being.
Wow. So kind of sounds like I'm setting myself up because I was considering having implants done, and I know that I have these pockets, and knowing I had these pockets and they telling me I need deep cleaning, that means I have bacteria and things in these pockets, and getting an implant before anything is done, whether it's holistic or general, to clear up this bacteria in there, that would just kind of set me up for having implants in there on top of an area that's really not free from infection. Does that sound right, doctor?
Yes, these are the protocols we use. We have to follow a certain schedule where we eliminate bacteria and then induce bone growth and healing, and then place implants or any restorative work for that matter. You're right.
Okay. Now, is there anything you want to add before we close out?
Well, I just wanted to mention that a lot of dentists are very good dentists, but as I said before, everyone has to be holistic these days, because it's not only the metals we use, it's not only the toxic metals or the procedures. We can have the best skills ever, but we really have to consider the whole body. What happens if we take a tooth out? Is the bite collapsing? Is your airway shutting down? Are you going to get sleep apnea from taking out 10 teeth that are root canal? What's your long-term plan? What materials are you using after you take your teeth out? Or what materials are you using when you're replacing the mercury or the amalgams? So all that has to be taken into consideration. You have to look at the whole body and how it affects your jaw joint or your tongue position,
Wow.
and your immune system. Are you introducing more aggressive materials that the body has to deal with when you're replacing something? So all that has to be taken into account. And try to stay away from antibiotics or aggressive drugs as much as you can, because there's always better ways to treat a person. If there's an infection or any disease, you have to first try to do no harm and then resort to conventional medication if you have to.
You can call here, or you can get a hold of us here at Max Herb Talk, and you can find out some information on different dentists that are either holistic, complementary, and also Dr. Sarkissian. You have a phone number, Dr. Sarkissian, or a website you'd like to share with our audience?
Yes, I have 5 websites, and you can access all these from my main website. It's www.sarkissiandds.com. That's sarkissiandds.com. Thank you very much.
All right, and if you're ever in Glendale, just get a hold of him. He'll be happy, and tell him, hey, you heard it on Max Herb Talk.